First, let me first just say a few words about operator syndrome and kind of how to understand it. It's not a diagnosis, it's a framework. And the premise of the framework is that high-risk professionals in the course of their work, whether that's soldiering in the combat arms, whether that's first responding, that they inherently are going to endure and receive a massive physiological impact on all of their physiological systems in their body. And we call this allostatic load. Allostatic load is a medical concept, a physiological concept, not something that's it's not specific, but what it is, it's a way of thinking about all of the different vectors that affect the body. So when we think of operators, that's repeated blast exposures over and over and over again. That's the high operational tempo, always going, always going, always going. So the cortisol and stress hormones are always elevated. It's the sleep deprivation. It's the circadian disruption that occurs. It's the physicality of the work, that leads to chronic joint pain, headaches. Then there are psychological issues that occur. Depression, anxiety, anger are probably the most common. We also see massive impairments to perceptual systems, so vision and hearing are impaired. TBI, a traumatic brain injury, leads to either mild, can even be severe symptoms of vertigo. So nauseousness combined with unsteadiness or dizziness. Then all of that, as you said in your opener, cascades into the social world. So you take all of that and it's going to affect your marriage. It's going to affect your parenting. It's going to have effects on your work, your ability to perform in your work, and especially after service, especially outside of your employment work, your service work, your ability to interact with other people is affected. Your emotions are affected. And we talk about existential concerns. So that could be moral injury, it could be survivor's guilt, it could be a profound changes in how one views one's faith, one's view of humanity. Moral injury often involves a sense of betrayal by the government, by society, by generals, politicians, etc. That's often a piece of this. And of
I love
course,
that. It's not just one thing, which is
it's not just one thing. It's a whole bunch of things. And at the very far extreme end, we see suicides. Suicide rate for military special operations and first responders is very high.